Hi, my name's Levi Dunlap. I handle the screw protocol bandaging post-surgery for the foals. I'm here with your filly, Well Kept. She's about 4 days post-op, and we're in the process of bandaging her right now. Some of the common problems with bandaging of screws across central Kentucky is white hairs. So we do everything we can to try to eliminate having them. So a few things I look for whenever we're doing screws is to have a big bandage around them. We try to keep them turned out during the whole process for enough time throughout the day for mom and baby. So we like to use a big thick bandage. In doing so, it helps protect the leg from any bangs, bruises, but it also keeps it from getting wet with the conditions in the morning of dew on the grass plus rain. If we use a thicker bandage, we can tend to keep them out a little longer without the wetness soaking all the way through to the leg. So we also put a steri strip. As you see here, the surgeon puts a steri strip over that leg to keep that incision protected. Now we'll bandage the leg about 8 days until that incision is fully closed, in which time the steri strip will come off, and we'll put a waterproof protective sealant over that incision, in which time we stop bandaging as well. So then they will go back out. I like to keep these horses in at night through the process. Sometimes they can tend to get into things at night when everybody's off the farm and it's only night watch, so we try to eliminate the possibility of any problems where we have to keep a bandage on this foal for longer than what's necessary. So we'll bandage the foal for 8 days, take it out of bandage. When the screw is removed, we'll go about another 3 days with the bandaging, and then we'll try to stop for good, barring no setbacks. But that tends to be the least amount of time you can keep the bandage on, but to prevent infection and white hairs associated with bandaging. So that's kind of the things we go through, and we'll go ahead and put the bandage on the filly now and get her back in the stall with mom. Now, when bandaging these horses, we like to apply the pressure to the front of the leg so that the pressure is not pulling on the tendon. So as you'll see when I'm bandaging this horse, I keep the pressure to the front and then roll it around with this, applying the same amount of pressure so it's evenly throughout the whole leg. Sometimes if you're applying the pressure to the back of the leg, you can give a little bow to the tendon. It's not very common, but it certainly can happen. But it's important to keep the same stretch to all the way through the whole bandage so that it stays even and stays up and doesn't fall whenever they're outside having more exercise. So one more thing we're doing is also with Root and Riddle, who does all our surgeries, is that we're researching how we can always be better. So with this sheet, we have an assessment every 2 days. I measure the fetlock, seeing the diameter of the fetlock, making sure if there's swelling, drainage, lameness to the horse, and my comments based on what I find. What they're trying to do is get better on their end and see. Sometimes they use different size heads on screws to get different results. So they're playing with those to see if we can have any better results with different size heads, if they have less swelling or can get along with it better. If they have more infections with certain screws, then they'll of course use the other screw. So we're doing a couple weeks study for each horse, in which time we'll do radiographs at the end of the study for each horse and determine at a later date what is the best way to have a successful process of the screw. So I hope this insight is helpful for you, and cut the rest because I screwed that up.